Royal Melbourne Receiving.
Yeah, g'day, Royal Melbourne. It's Alex on Micah 3. We're coming to you within about less than 10 minutes. Motorcyclist, closed head injury.
A call's coming in from paramedics rushing a critically ill patient to emergency.
Do you know what the mechanism was?
Yeah, motorcyclist versus car. This is the motorcyclist.
So, a motorbike accident.
Senior emergency Dr. Sarah Whitelaw and Dr. Jason Gabriel Anasaur are preparing to treat the unconscious man who crashed his motorbike and was thrown headfirst into a car windscreen.
So what do you want to do? You want to do the airway?
I haven't done it.
All right. Do you want to manage it?
I'll run it.
Do you want to run it?
Yep.
And I'll back you up.
Okay.
So we've got a motorbike accident coming in. Their heart rate is very fast, so possibly bleeding. This case is one of our most difficult type of cases because we don't get a lot of time to prepare. And I'd be lying if I said there's not, stress and adrenaline around this situation.
Hey, Matt, can you get me some blood for an unknown male?
We've not really got much to go on at the moment, so we're just kind of getting the team together and kind of planning for potential injuries and illness. Okay, guy, patients here. If you're going to be in the room, can we get some lead on, please? Okay. So, can we keep the noise down? We'll get the patient across. Can we get full monitoring on? Ilya, if you make your airway assessment and get ready to tube.
So just quickly, this is a motorcyclist. He was travelling, the witnesses say, about 50 k's an hour coming around a bend onto a main road. There was no helmet in evidence. He's got abrasions all around his body, but his main injury is a closed head injury. Bleeding from the ears and from the mouth, thick clotty blood.
1, 2, 3.
10 minutes ago, we loaded roughly.
I'm guessing we don't know any past medical history or anything.
We don't
else.
know his name. We don't know the registration number of the motorcycle or the vehicle. We just didn't hang around on scene.
An accident on a motorbike, particularly if there aren't helmets involved, we know can cause really bad facial and head injuries. We always prioritise injuries that might interfere with breathing, and we want to stop any sort of active blood loss.
The patient's condition is so critical, another doctor, Bjorn Macon, joins the team to help clear the man's airway so he can breathe.
We have to address the immediate life threats in the patient, and the first thing is always going to be the airway, because without oxygen, the brain will die in 5 minutes.
So, team, priority will be to secure his airway. Quiet in the room, drugs are going in, please. Yeah.
I'll let you know when to proceed at 60, okay? Stop bagging. He's actually stopped breathing now. I got it.
Do you want to come from this side or the other side?
I'm coming from this side.
Okay.
With help from Dr. Bjorn Macon, the race is on to get their patient to breathe.
In the back of my mind, I'm thinking this is going to be very difficult because the patient is bleeding into his airway and is, in essence, drowning in his own blood.
Okay, let's go. Yep, I agree. I'll squeeze.
Sats is 78. We know that we need to get oxygen into this patient immediately. Normally, we would put a tube in through a patient's mouth. In this patient, his face is so badly damaged that that's potentially not possible. Talk us through what you're seeing.
Okay, Sats is 77.
Okay.
If we could bag, let's just pull out and bag him.
Okay.
Sats are still at 77. Can we go two-handed if we need, please?
If we can't get the tube in the usual way, that we're going to have to make what we call a surgical airway, a hole through the front of the neck, and put the tube in that way.
Okay, Sats is 71. Bjorn, are you getting surgical kit ready?
Second attempt, and then we're set up to do a surgical airway.
Okay.
Well done. Okay.
Okay.
Okay, just keep going, keep going. At 64 is...
And is the oxygen turned up all the way?
The trauma team needs to focus on the man's breathing. It's touch and go.
Okay, sats are coming up, guys, so we're in the right place.
Sats are coming up. We're going in the right direction.
Well done.
With the patient's breathing now stabilised, the priority is looking for any life-threatening internal bleeding and brain injuries.
We need to get a CT quickly, don't we?
Yeah.
Got a CT ASAP.
I guess one of my questions is he actively bleeding from anywhere? Kind of can see he's bleeding from the right side of his right ear and it's actively dripping.
Main concern is a significant closed head injury. CT are ready for us now.
So significant head injury, but other than that, we don't know. But I would describe him as critically injured.
In the midst of the chaos, Dr. Sarah finds out more distressing news.
The police have just let us know that this gentleman's brother was also involved in the accident. So his brother is actually here and also injured, and we'll have to find out how severe his injuries are.
I wouldn't be surprised if he's got something else with the speed and the lack of protective gear.
In the CT room, Dr. Sarah Whitelaw's motorbike crash patient is slipping between life and death. Scans show massive fractures in his skull.
He was pretty close to dying, I would say, quite frankly. Ultimately, it's quite likely he'll need to go to the operating theatre with a neurosurgeon.
After helping Sarah bring the crash victim back from the brink of death, Dr. Bjorn Maken is called to resus to treat the younger brother, who was on the back of the motorbike.
ED is all about an ability to rapidly respond to the situation and to be pretty malleable, both in terms of your brain and in terms of your mood. It's almost masochistic, isn't it? Lack of control.
Ready? 1, 2, 3.
And the reason you say the shoulder is dislocated is... Yeah.
Can't move it much.
Yeah. Whatever's going on, there's something. Take some deep breaths for me.
Before he can deal with the dislocated shoulder, Dr. Bjorn must first check for any internal bleeding.
We're going to cover you up and get your pants off, okay? Are you wearing... you're not wearing undies?
No.
Yeah, but we'll cover you up with the blanket, okay? Listen to me. I have to look at your legs, okay? You've just come off a motorbike. You just need to let me do my job, okay? I need to ultrasound your tummy. I need to take those pants off, okay?
I can see that there is a very confused and I would say at worst brain injured, I suppose at best probably concussed patient with other injuries. So I made the decision then to try and calm him down, deal with his injuries. So it is a difficult situation.
The ultrasound rules out bleeding, so Dr. Bjorn is moving on to the dislocated shoulder.
Please.
It's okay.
It's burning.
It's okay, that's normal. That's normal. Get used to it. And we're done.
The team has successfully put the man's shoulder back in place. He has no idea his elder brother's life is on the line.
It's one of those, I think, sad situations where we haven't actually been able to tell him that potentially his loved one is quite severely injured.
Open your eyes.
Good. He's still got a concussion and he's not really making new memories. So we're going to have to wait for him to sort of start making those memories before we then try and break the bad news that his loved one's potentially got an unsurvivable brain injury. We'll have to see.
All right, so I think he's really tachycardic. It's quite possibly because he's in pain. He's got a really whopping great palpable pulse now. I think we need to make sure that he's adequately analgesed and sedated.
Back in Trauma 2, Dr. Sarah Whitelaw's team is still fighting to save the motorbike driver who crashed and was thrown head first into a car windscreen.
Hi, it's Jason in Emergency. We've got an unknown male. He looks to be in about his 30s. So he's been seen by the trauma team, neurosurgeons here.
To reduce the dangerous swelling on his brain, neurosurgeons have been called in to drill a hole into the patient's skull.
We're worried about increased pressure within his brain. So the neurosurgeon's gone to go and get a device to put in to monitor the pressure in his brain.
Down the corridor, the driver's younger brother, who was on the back of the motorbike during the accident, has had his dislocated shoulder fixed.
We can't tell anything yet, sweetheart, because he's just been to scan.
He's also concussed and has no idea how seriously injured his brother is.
This young man hasn't got the same severity of injuries that his brother does. I think potentially because his brother actually provided to use a very poor term, cushioning against the forces that were going through his body. I can only imagine putting myself in that position, how devastated I would be to know that my sibling was dying in a room next to me.
There's not a lot more we can do. He will need to go to the operating theatre and then probably to the intensive care unit.
As the driver is wheeled off for surgery, his younger brother is monitored nearby, and Dr. Bjorn takes a moment to reflect.
When you're constantly confronted with these situations, in order to protect yourself, you can wall off your emotions. And I think that something that is very difficult to do is to remain open to these situations, I've heard someone describe it as sit in the rubble is one of the terms where rather than trying to say that everything's going to be okay, you actually sit in the rubble and the destruction that's there with the person. And I find that that's very difficult because I'm a fix-it kind of person, but some things are unfixable and there's nothing that you can say that's going to make it all right. What a horrific, the worst days of their life.
Stats are 78.
Dr. Sarah and her team resuscitated the elder brother in the motorbike crash case. He was rushed to surgery to relieve pressure and swelling on his brain. Despite the efforts of the emergency and surgical teams, the man's injuries were so severe, the next day, he lost his fight for life. Dr. Bjorn's patient, the younger brother, was kept overnight for observation and then discharged from hospital.